Hey guys, welcome back to my channel. My name is Cassandra, and in today's video I thought I'd show you how I take care of my teeth, my dental health care tips that I have. My first video that I made, I mentioned that I am a daughter of a former dentist. My mom's a retired dentist. I think it's about maybe 4 or 5 years now. And I take a lot of pride in that. I'm so glad I listened to her all these years, taking good care of my teeth the proper way. I never had a root canal, I had never had a shot in my mouth, never had cavities. So I always had really good teeth growing up. I got a lot of compliments from a lot of people asking me what I use to whiten my teeth and just what I do. And I think also, there's a lot of misconceptions on taking care of your teeth and how to properly take care of your teeth, and I thought I'd show you guys, make a video and answer all those. And also, I think people should take good care of their teeth, not just for aesthetics, but it can actually be detrimental to your health. Yeah, you can actually die from not taking care of your teeth if it gets really, really bad. My mom told me that if you have an infection in the upper jaw, it will spread to your bloodstream and go to your brain. Your brain has kind of like a blocking, I don't know how to describe it, blocking thing that prevents, it's supposed to protect and prevent from bacteria, and if it passes that, it'll get to your brain, kill you. And if you have an infection and you don't take care of it right away, and on your bottom jaw, it'll go straight into your bloodstream and go into your heart and stop your heart. So that's happened to a lot of patients of my mom's and her friends, patients as well. So definitely take care of your teeth, guys. So if you're interested in finding out how to keep all your teeth, then keep on watching, because there's more to just brushing and flossing. Sorry guys, I had to open the door because it's so hot in here. So the first tip I have regards brushing your teeth, and I know what everybody's gonna say. We all know how to brush your teeth, but do we all know how to properly brush our teeth? So a common mistake or misconception we have when we're brushing is to just go like this, right? But that's wrong, actually. You ideally want to brush in circular motions, like this, because what this does is wear down your enamel, for one. It also wears down your gums. That is actually what causes receding gums, and receding gums is when your gums just pull away from your teeth, so it just exposes your teeth more. It causes soreness. You don't really want to do that because, one, it looks terrible, and you can never grow it back. So that's a common misconception. It doesn't take a lot to take the plaque off your teeth, which is what we're going for, right? But yeah, just brush in circular motion. And then you don't have to brush for 2 minutes, just as enough to run over and cover all your teeth, and that's it. Ideally, you want to brush twice a day. I wouldn't recommend more than that because, again, you don't want to overbrush or overdo anything, because that will wear down your enamel and your gums, and you can't really regrow your enamel. And your enamel is the outer protective, it's kind of like your skin, how it has like layers of epidermis. Well, the outer layer of your teeth is the enamel. And another misconception is toothpaste. So the toothpaste and the brushing, the toothpaste is not designed to just clean your teeth, yes, but it's also to just strengthen your enamel. If you can't really remember to do circular motion, or you can't be conscious of it like me, I forget when I use one of these manual toothbrushes. I don't know, like when I'm brushing or I'm talking to somebody while I'm brushing or something, I forget to brush in circular motion. So I highly suggest investing in a electric toothbrush. It could be anyone. I use Oral-B. Oral-B is good. They are pricey, but it's definitely worth it. You can just run it over your teeth and you're done. And it does all the circular motion stuff for you. So That's great. And the second tip I have is regarding flossing. And I know we all know that we're supposed to floss. Ideally, you want to floss like once a day. And why do we floss? Because our toothbrushes can't get in between our teeth, and that's where the bacteria builds up, and you don't want it to sit there for so long. And you don't have to floss like after every meal unless it bothers you. But what flossing does is it interrupts the bacteria and plaque from colonizing in between your teeth, and just gets those, you know, hard to reach places. So I recommend, just any floss really is good. And if you don't want anything to like wrap around your fingers, so sometimes that really bothers me, I like to use like a floss pick. Yeah, floss pick are great. So the third tip, or just advice that I have, regards to anybody that has braces. And I like to point this out because there are a lot of people I know that had braces and had to go on a second round of braces, which is terrible. For one, nobody likes to wear braces. I didn't. It is painful. It's not aesthetically pleasing. It's just annoying. I wore braces for 3 years. I didn't have to go second round. You know why? Because I have retainers. We all get retainers after we're done with braces, and we should definitely use them. And you don't have to wear these all day. Just, I wear these at nighttime when nobody can see me and I can fall asleep with them on. The reason why you want to wear these is because it prevents your teeth from moving. That is why people go the second round for braces, because their teeth keep moving if they don't. So yeah, it's just simple. You don't have to pay for another round. Just keep wearing your retainers. You'll notice if you haven't worn your retainers for a while, it'll get tight because your teeth move. A lot of people complain that, oh, I wore braces and my teeth still move because they didn't wear retainers. I do have bottom retainers, permanent retainers. So I guess, and then I have these, of course, for my top, but the bottom retainers are supposed to keep my teeth from moving, because if my bottom teeth move, then my top teeth will move along with it. That is why. You can see, I'll show you guys here. I only have it right there. And I use a floss threader when I floss to go through it. This thing right here, you can get it at pretty much any drugstore. It has a little like string that's kind of coated, so it won't be flimsy when you stick it through your teeth and underneath your wire. And then I use this part to kind of clean it. It's like a little sponge. And the fourth thing I like to talk about in regards to whitening your teeth. I get a lot of compliments on my teeth, how white they are. Honestly, I don't use any whitener other than, I think personally it's my toothpaste, sorry. My toothpaste. This is what I use. My mom just highly recommends Colgate. Honestly, don't know why, but I guess if it works for me, it should work for you guys. And it has a whitening agent too. So that's all I really use. And I think also another reason is I don't drink coffee or tea or anything that really stains your teeth. Mainly personal choice. I'm not a coffee or tea drinker. I love water and juice. That's pretty much it. If you do drink those things, whitening strips are good too. My mom recommends that. They do make your teeth a little bit sensitive, I think, with any like bleaching agent for your teeth. So, but Crest White strips are good. I don't like that they don't stay on my teeth. I use them once in a while, but sometimes I'm lazy. So really the only whitening thing I have is my toothpaste. But I just don't like when it like slides off, you know what I mean? Like, because of my saliva. But those are still good and they're cheap. So, and that transitions on to the fifth thing I have to talk about, and it regards to what you drink and what you eat. Honestly, I don't drink anything that like sugary stuff, mainly because I don't like sodas. But the only thing I really like is that can be detrimental to your teeth if you don't take care of them is kombucha. And kombucha is acidic as well. It's good for your gut health, but it's not good for your teeth. The acid wears down your enamel. That's why it's not good to, you know, suck on a lime or suck on a lemon after drinking a shot of tequila. Or just, some people just eat lemons whole. It's not what I do because I don't like them. I do have a hack or tip if you like those things. I'm not saying to stay away from them completely. You know, everybody loves their things that they eat, of course. But since I like these, my mom told me that I can rinse with water. Okay, this is not carrot juice, this is water. I just filled this carrot bottle juice thing with water, but yeah, so every time I drink a sip of this, I rinse my mouth with water, and I just drink water every time I drink this. I mean, it hydrates you, why not? So that's my kind of life hack that I have. Because if you leave the acid on your teeth for a while and let it sit, like I said, it will damage your teeth. So if you ever want to drink, you know, soda or eat a lime, lemon, whatever, and if you care about your teeth, just simply rinse your mouth with water and drink it every time. Okay, that's it. That's all I have for you guys. And I also wanted to point out though that this is not to replace a dentist. You still need a dentist even if you take good care of your teeth. I still saw a dentist after my mom retired. I would see my mom's colleagues and dental friends to still clean my teeth, because I know here I get a lot of tartar, and tartar is just basically plaque that just calcifies, because in our saliva we have calcium, and the one area, well, there's two areas where the saliva just develops and produces is right here. I forget the second place, but I know right here I get a lot of tartar, and that's normal. I still need to see my dentist every 6 months to just pry that out and clean that out. Like I said, because of the saliva that just builds up there, that's where it produces. But anyways, if you guys have any questions for me, please leave them down below. I'd love to answer them, or my mom can read them and answer them. If you want any advice, especially since we are in quarantine, maybe in some places, I don't know where you are, you can't see your dentist right now. Maybe we can cover that and comfort you guys. Don't forget to like and subscribe. Maybe share this video with anybody who is also curious about their teeth, I guess. And I also hope this inspires anybody and encourages people, gosh, I can't say that word, to take better care of their teeth, because it's important. Make sure to hit that bell icon so you will be notified the next time I upload, and you won't miss a video from me, okay?